I'm Dr. Troy Spurl, and our podcast is Synapse Snps. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's official synapse, synapse.com. Hello and welcome to Synapse Snips. This is Dr. Troy, and I'm joined today by three of my very, very important team. I'm going to have them introduce themselves. So maybe we'll start up in the top corner. Ellie, if you want to go.
Yeah, hi, I am Dr. Ellie. I am excited that I'm joining the Synapse team. I am bringing some really fun different attributes to the team. So I got my master's in nutrition and then my doctorate in chiropractic and then my additional training in pelvic floor from Herman and Wallace. So I'll be bringing topics such as PCOS and pelvic floor education to this podcast today.
Great. Richelle, you want to go next?
Yes. Hi, everyone. My name is Richelle. I'm a physician assistant. I'm so excited to have Ellie because I came from a traditional medicine background, but I am now in the functional medicine world. And so I do things of hormone therapy here, bioidentical hormone therapy, not synthetic, HRT. And it's been a really fun journey to get to know a lot of the Synapse family because there's a lot of people that have hormonal unwellness and we get to optimize it for them and really solve some really fun chronic solutions that have easy answers to just getting them into a new platform of wellness. And for example, that's where Ellie comes in. A lot of the historical treatment of PCOS has been very pharmaceutically based. And little did we know, there's a lot in your diet that you can do. So I'm excited for her to jump in on that and tell us about what she knows.
Awesome. And beside me is Tammy.
Yes, hi, I'm Tammy. I'm a nurse practitioner. My degree is from St. Catherine's University, and I'm an adult geriatric nurse practitioner. I first degree was exercise physiology and nutrition, and now I'm kind of making my way out of the conventional world into functional medicine. And I support here with Synapse with the regenerative medicine.
Yes, and I am Dr. Troy, founder of Synapse, and the only male on this panel today, so I'm going to be very quiet. Ask a lot of questions because our topic is peace of mind around women's health. So we're going to really dive into a lot of the specialties that each and every one of you offer, but also just the need that's out there. So let's start just with Dr. Ellie. If you can tell us a little bit about your specialty when it comes to the pelvic floor and just how you work with that, and then some of the things that people might be struggling or suffering with when it comes to that.
Yeah, so pelvic floor dysfunction is actually pretty common. About 1 in 3 women will actually experience it throughout their lifetime. So that's a lot of women out there. Some of the common symptoms that you can find with these women are leaking urine with coughing, sneezing, laughing, jumping. That's called stress incontinence. And then also urgency to urinate. Even if the bladder isn't full, these women have these sensations that they need to urinate. And so they go pretty frequently. Another component that pelvic floor health can help with is actually constipation. So there's a lot of muscles that go around the rectum, and if those are too tight, it actually doesn't allow the rectum to fully relax to be able to defecate. And then there's also pain during sex. We'll be talking about that today too. That is very psychologically hard when you want to have intercourse, but it's just very painful. So that is where I help a lot of women to be able to relax and strengthen their pelvic floor to be able to have that sensation be pleasurable and not painful. And then kind of some other things are like if you have lower back pain, you can also have pelvic floor dysfunction. Everything is really connected down there. So you want to make sure that you're looking at the whole picture. And then one of the last one is pelvic organ prolapse. And that is a sensation where either the rectum or the bladder is actually falling into the uterus or the vagina, kind of causing some uncomfortable sensations and symptoms like that. So some different ways on how to be diagnosed with pelvic floor dysfunction is that it's pretty based off of your symptoms. You can get an ultrasound, but typically it's just based off of a pelvic exam. And yeah, so that's a little bit of the pelvic floor.
Yeah, it's very, very important when it comes to just the foundation too for the rest of the body up. So we've seen the need to bring on someone with that specialty. Now, this question is for both you and Richelle, because you approach this from a couple different points of view. In functional medicine, we do look at hormones, and we like testing like the Dutch hormone test. So I know you use that. Tell us a little bit about hormones, and then Richelle, I'll have you put your 2 cents in, because you look at hormones too from the nutritional model, but applying the functional foundation as well. There's a nice way where we can look at that and get really a well-rounded picture of what's truly going on with the hormone status within the body. So tell us a little bit about how you like to use the Dutch testing, what that is, and whether or not hormones play into pelvic floor dysfunction in particular.
Yeah, so the Dutch testing is a really great test. I like it because it gets sent to your house. It's urine based, so it's pretty easy to use. And then it gives us a really good understanding of where the foundation of your hormones are. The correlation between hormones and pelvic floor, although it might not be as evident, is that estrogen in particular plays a huge role in muscles, but also lubrication. So if you decrease your estrogen, also some testosterone as well, you actually have a decrease of the tone of all of your muscles, and that includes the vagina and all of your other pelvic floor muscles. Tammy has a lot of really good information and really good therapies that we can be using on this. And then also being able to bring in Richelle with this of doing bioidentical HRT is going to be amazing for patients. So if you are able to correlate your hormones to your pelvic floor, you can actually start to create this holistic wellness approach. Richelle, what more do you have to say on that?
Yeah, no, that's good. So Dutch test, I think, is always a great first look into your hormonal status, and it can be used whether you're premenopausal, perimenopausal, or postmenopausal. It exists across all functional modalities of your menstrual life cycle. I particularly use blood, and I forgot to tell my certification in the beginning, because I'm WorldLink medical trained, which is based off of blood-based studies. These are not just theories, these are applications of clinical trials where we've used actual bioidentical hormones in large population studies. And for those trials, we use blood-based chemistries. So I exist in the blood-based space, while Ellie might use the urine metabolites, but both complement each other in unique ways. So if you're looking at a comprehensive panel of your hormonal health, you might start with the Dutch test and then graduate up to something of blood work based. But the reason we do this, in particular in my world, is because I want to understand what the tissue penetration levels will be of the circulatory hormones that exist within your current unique system. So whether you're perimenopausal and you're just starting to lose your progesterone, whether you're 22 and you have severe PMS symptoms or PCOS, at a younger age, whether you're postmenopausal and now your progesterone's kind of filtered out, your estradiol has started to be lost, but your testosterone's still staying a little steady. We're going to be able to help you delineate where you are in your journey through these unique modalities, and then prescribe or change your diet or get you into regenerative lifestyle choices to help you through whatever transition is occurring, or to dial back in onto a pain point and try and mitigate it. Because guess what? PMS, that's actually not normal. It means something's going on with your hormones. You're not supposed to PMS, ladies. And I was going to say gentlemen, but it's only ladies here. So, we can do some things to really help you based on what we discover in both a urine sense and a blood-based sense. And that's part of the foundations of what you get here when you come to check on your hormonal health with Synapse Clinic.
Yeah, I'm going to just play and I should not make any comments on the PMS card right now. I'm just going to go right past that one and talk about the Dutch, how it helps us with understanding the detox. But I've seen you, Richelle, be able, I think because of how much research there is and just how attentive you are to the details, I've seen you be able to dial in what people need and course correct based on what they're actually experiencing. And for us in functional medicine, hormones are one of the foundational components of brain health, of recovery, of the ability to sleep. to feel and sense pain. A lot of the foundational components of how women in particular are able to sense the world and the environment around, be with their friends and family, is drastically impacted by those imbalances. So I've seen you very, I don't want to say methodically, because you actually have at this point an intuitive component to it where you know because you've done it so often, but working together with the Dutch and the blood has been really fun to see. So I'm excited to see what more you two do together now that we've added Ellie to the team.
It'll be a lot of fun. And you know what's interesting about blood is that, and this might be the same with Dutch, I don't know, Ellie, you could tell me, but we have certain timelines depending on where you are in your menopausal, perimenopausal, or premenopausal journey. If you're in a premenopausal state, I like to capture blood work around your ovulation season, because that's where your estradiol will peak and that's where your testosterone will peak. And I want to look into that. If I can capture that window, I want to see where you're living. Your progesterone peaks around day 22 in your cycle if you have a normal menstruation, 28 to 30 days or so. So that's where I get my blood work. But if you're postmenopausal, you're not doing the ebbs and flows. And so I don't need to capture a window surrounding your ovulation. If you're perimenopausal, we call it no man's land, anything goes, just go get the blood work done, because we don't know if you're going to be up or down on Tuesday or Wednesday. So not to be rude, it's just kind of funny around the situation. So blood work based, we have a little bit of some unique glances and ways that we interpret things based on where you are in your cycle and what your history has been with your cycle. We can even capture, Ellie will attest to this, PCOS, if we don't know where your cycle is. And, oftentimes PCOS patients have irregular menstruation. And so when we look at the blood, we can kind of tell them a status update is what's going on, because we don't have the routine signals that they should be getting of a shedding of a endometrial lining and things like that. But Ellie might know a little bit more. I don't know what it's like on the Dutch test when you're looking for things of that nature and PCOS symptoms and things like that. But on the blood work, it's fascinating to see.
Yeah, that's a really good point. Dutch test, there's a couple of different tests kind of depending on where you are, if you're menopausal or postmenopausal. So I kind of depending on the test, kind of depends on when I want you to take it. There is a Dutch test that you take it almost every day for a whole month. And so we could get a complete panel of your hormones and see, exactly where they're going. That one I like to kind of say for my patients who are, one, really routine and really good at taking tests, but then also who have a lot of things going on. So completely depends on each patient when we want to take them.
Yeah.
So this is really important, because I've had patients come in and say they've gotten hormone labs, and I've asked them, did they talk to you about when to take this? Mm-hmm. And I know, Richelle, when you first came in, you said day 13. Mm-hmm. I need it around day 13. That is so drilled in my head right now. And I know with Dutch too, just to make sure you're getting accurate results for the one, there's a specific day where you have to prep for it. You can't eat certain things ahead of time. So there's actually things to prep for it. And when I've asked a lot of patients, did you prep for it? Did they talk to you about specifically what day to come in? And I'm surprised by how often they may have gotten the right test. It's a great test, but they didn't prep for it. The level of specificity you guys have with this is very, very important. So that's been a huge testament just to getting results. That's how you know when something's not working or right, because of just the attention to detail when it comes to that.
Yeah, well, we are
intricate. A little tip of the cap to you guys.
Yeah, well, thank you. We're very intricately built, and there are certain windows that we need to look at certain things. I find it fascinating how with hormones, for example, it's deviating a little bit of the conversation, but how when we check into estradiol, progesterone, and testosterone, and then we prescribe certain things to help re-regulate or balance, calm, etc. We don't do that with like neurotransmitters. Isn't that interesting? Where we don't like test when we put somebody on an SSRI, their serotonin levels, and did it increase to a certain proportion or ratio, et cetera. So it's very unique that this space and this hormone world has gotten rules and regulations and research dedicated to it in that fine-tuning way. It's a joy to be a part of, but I just find it interesting that this is the space that gets that microscope. But it is a really great microscope to be a part of.
When it comes,
for example, right? Go ahead.
Yeah, sorry, you cut out on our end there a little bit.
It's okay.
We're going to dive into the PCOS a little bit more in depth a little bit later. I want to go to Tammy here. just to talk a little bit about why we brought her in. So when it comes to some of the things that Tammy's doing, she's looking at IV therapies, she's looking at the regenerative medicine. So as women age and we are assessing foundational stuff like hormones and like the diet and the sleep, there's also the actual regen department. So do you want to speak a little bit about what you're doing there with the regenerative medicine? And you are primary care as well, so you can speak into that a little bit too when it comes to women's health.
Yeah, absolutely. Well, the one thing I love about Synapse is we work together as a team. So if they see Dr. Ellie or if they see Richelle, they can refer to me as well, because this is just an adjunctive therapy for these patients. If they've done blood work and they went on their hormones and did the testing and the treatments and the exercises that Dr. Ellie would do, and there's no, let's say there's some relief, that's nice that they can include me into it, because in regenerative medicine, we kind of think outside the box. Can we inject things? Can we do IV therapy to regenerate some of the nerves that might have been lost, or tissue to be grown? And so I'm excited to be able to offer that for sexual health. And also just with helping women in general, when they have PMS or having hormone issues, that we can offer more things with that.
And then some of the IVs are there for some acute issues. And then also, we're not going to make some specific announcements, but the stuff that we're working on right now, just for peace of mind around the immune system and how it protects your DNA. And also post-COVID season, we're seeing a lot of issues. So I'm going to have you and Richelle speak to this one, because Richelle and I were just down in Atlanta at the annual conference for the Independent Medical Alliance, the former FLCCC. And there's a lot of information coming out there. So I'll have Tammy, I'll have you start a little bit just with some of the IVs and what they can do as it relates to just boosting your immune system or protecting the DNA or reducing inflammation. Speak to that a little bit. And then Richelle, if you could do a little recap on what you kind of saw down there in Atlanta at the recent conference, that'd be great.
Yeah. So we're creating different protocols, I would say, for IV therapy. And when it comes to like inflammatory, let's say acute illness, someone has the flu or they contact COVID, it is one of those things we can do when they're acute. There's different protocols and different dosings with that. And it's really the goal is to like decrease inflammation, get out toxins, really try to like get them back to their baseline. We can include IV therapy with multiple things, including fertility if there's issues with that. And just in general, let's say they have an acute gout attack or acute migraine, because women with hormone imbalances, migraines is a really big issue. So those are things that we're incorporating in our practice.
Yeah, so I love that. I love so much about the IV, because IV has a potency and a power to it, and a mechanism that is different than what I can prescribe over a telehealth capacity or in the office with, creams or pills and patches and things, right? I always keep my things around me. So IVs I love because I came from a hospital world, and boy, they whipped you up into shape real quick, right? So I am a big proponent of that. But again, that's a whole multimodality approach that you're going to get from a Synapse type of consultation and longevity of health analysis and then restoration. So to Troy's point about the IMA, it stands for the Independent and Medical Alliance, and they were really the birth tank of how to treat COVID well. When COVID came about, when we saw this restriction from the media and government legislation, powers that be, towards the treatment of boosting the immune system and trying to rehab people's bodies after a post-COVID experience, because this was something that was foreign to most of us, and really all of us, because COVID and spike protein is not something our body's very cohabitable with. So we had unique problems, we had unique conundrums, and we needed solutions and answers from people who really did honest and ethical medicine to get people well. So this group, Independent Medical Alliance, was formerly called the FLCCC, the Frontline COVID Critical Care Alliance. And they have since changed the name. I think I got it finally, the third C in there. They've since changed their name to the Independent Medical Alliance because that's really who they want to become and continue to progenate into going forward. They have switched the focus from how do we help people get well, how do we build protocols for that, and they still have that all intact. And a lot of them use the IV modalities that Tammy and Synapse are going to be able to incorporate for you. But they're now switching over into a public health policy organization as well, because we realize that we've got to get the right people in play if we're going to continue the legacy of honest and ethical medicine. So Troy and I went to that conference because we want to be at the forefront of both of those worlds. But what is so important is that as we're developing protocols that are restorative, that are immune system saving, that are going to regenerate your lifestyle and shape you up for the future and promote longevity of health, we also have to protect the freedom to do that, is the best way to say that. And so IMA is that type of a balancer in the public health space. Did you have something specific from that conference you want me to talk about, Troy?
Yeah, I'd like you to comment just on one other thing, because they had some interesting panelists there. Have been doing just amazing work, but they had an oncologist on there who was talking about some of the challenges that he has seen post-COVID and how things have changed. So what he used to do is not as effective as what it once was. And so he started speaking to the needs of adding things that we've already equipped ourselves with here at Synapse. Sure. So for the most part, I remember just looking back at Richelle, and we were both kind of thinking the same thing and saying it like, oh boy, we're set up for this really well. This is our world. He's talking our language right now. So maybe speak to that just a little bit, as far as I don't expect you to summarize the whole thing, but you do it so eloquently. I just want you to relay just a little bit of what you heard from especially the oncologists and women and breast health in particular is just something that's very, very important. My sister was diagnosed with breast cancer, and it's very, very close to home to have an established program and protocol for proactive healthcare when it comes to breast health.
Well, so there's a lot of things going on in that conversation, so I'll speak to the pieces that I know. But in the post-COVID world, I like to say post-COVID, whether infection or injection, a little bit stronger on the injection side, okay? We do know that there is a correlation of an uptick of cancer on the rise because the COVID virus does promote itself like an promoting oncogenetic virus. It can do damage so badly to your immune system and to your tissue structures that it can promote an environment of inflammation, of T-cell dysregulation, and a bunch of other things that allow cancer then, if it was latent, to come back into life. If it was there but it was never known and was slow growing, is now full blown. Unfortunately, we're seeing a lot of that. So to your point, Troy, breast cancer is one of the top cancers we're seeing, neurological tumors, melanomas, lymphomas, and then weird situations where you have two primary cancers. Like the other day, I had heard of somebody who had a breast cancer and pancreatic cancer diagnosed at the same time. That's not normal. That does not happen. And it is respective to some of what we know about these, particularly mRNA vaccines. I don't know if you want me to go into that, the political science conundrum of the vaccinations and kind of how they do that.
We'll save that for another time. We'll just help people with peace of mind.
But we'll get onto the hope side of it. Okay, so that's kind of the status update, right? There's some murky waters when it comes now to this post-COVID world, and then cancer and its uptick. Colon cancer also we're seeing in a lot of young people, and that's a very old person disease. I don't mean that rudely. I just mean we usually see it be indolent and come around in the 50s, 60s. Now we're seeing it in young 20s and 30s. That's weird. Something's wrong. But what's cool about, and cool, I'm a millennial there. I just use that word. What's cool about Synapse and why I love working with them is because there are things that we're doing that are cost effective, gentle to the body, and immune supportive versus therapies like chemotherapy, immunotherapy, and radiation, which are very toxic to the human system. They're toxic for a purpose, but they come with a great cost. But there are other things that we can maneuver with and utilize, repurpose pharmacological drugs like ivermectin and mebendazole, like methylene blue, like high-dose melatonin. There's certain players that we can put into play to synergize the work of the immune system to allow your body to go after what's been dysfunctional or is being destroyed. And that is where I think a part of our matrix and mixture comes into being ready and available to help the American population right now.
Yeah, it's fantastic. And I think the combination of the functional medicine being able to assess the physical body, the chemistry alongside with the work that you're talking about there, gives us a unique position in that we're able to actually see what's working. If it's working for you, measure it and help people navigate through this tough challenge. So it's so good what's actually happening. Very, very challenging. So I don't want to minimize a lot of the struggles people have been going through, but it's so optimistic what we're seeing in the healthcare world when it comes to this, because of the conversations being had between the traditional and functional medicine worlds. So we're pretty pumped on that at Synapse. With that being said, there's a link between PCOS, there's a link between spike protein scenarios, and there's a link between infertility. So I'm going to have the three of you kind of talk about PCOS. I'm going to have Dr. Ellie start us off there, because that is also one of your main areas of focus that you love to work in. So I'll have the three of you kind of comment on that.
Yeah, so I really kind of fell in love with helping women with PCOS through my own hormonal dysfunction. I had so much dysregulated cortisol that threw the rest of my hormones out of balance. And so I was able to normalize my hormones with nutrition and supplements, and it completely changed my world. So I started working with women in hormones, and I started to just be gravitated towards PCOS because there's not that many resources out there for them. They're basically given birth control, or they're told to come back when they want to get pregnant. And although I think that some birth control is very beneficial, I know, Richelle, we love, when we work and start with progesterone to get their period back, that really decreases the risk of cancer, which I love. But often there needs to be more to that. So I really help a lot of my patients by just kind of using nutrition to regulate their intestines, their ovaries, their liver, their brain. Then we go and we use the Dutch test. Now I can use Richelle for that blood test to get even more specific on those hormones, and making sure that each hormone is really well addressed. And then we work on thriving and making sure that everyone is functioning really well. Kind of some of the common symptoms that you can experience with PCOS is really irregular or absent periods, excessive facial hair where you don't want it, and then thinning of hair on the head. So kind of the opposite of what you really want. Stubborn weight gain is very prevalent. A lot of women are just told to lose weight, and then all of their PCOS symptoms will go away magically. And then they try and they do everything right, but it just doesn't go away. And that's because your insulin and your hormones are working against you. But then it also really impacts their brain. So a lot of women with PCOS also have anxiety, depression, extreme fatigue, brain fog. All of those components I like to really address. And with Synapse, we do it all together to really address the body as a whole, because PCOS is such a multifactorial disease.
Yeah, I think so on my end with PCOS, one of the things I like to focus on and optimize is your vitamin D. I like to look at your thyroid health because that plays into it. And then I like to look at your insulin sensitivity or resistance. And we try and start from those platforms because that's really the background of the quote disease. PCOS could mean that you have cystic ovaries. It might not actually show that on an ultrasound. We might actually capture it because of blood work instead of what we see on a scan. It's difficult because you often go, I think my women that have PCOS feel like they go unheard, or they go and are told, here's your one option, like birth control. And I think, so that's why I was so excited when Ellie came on board, because I know some of the pharmaceutical tips and tricks like metformin or spironolactone, but those come with their own disadvantages. They're useful, but not what everybody who comes into Synapse is really looking for, because they want a functional approach. And so with Ellie on board, I was like, oh, finally, we have somebody who can do the nutrition component, who can do the lifestyle component, who knows the supplements they can mimic and help with insulin sensitivity and improvement. But then from my standpoint, I technically have the script to be able to write you for progesterone should you need it. And I find that can be often very, very useful, especially if you're somebody who has PCOS and wants to get pregnant, because you're not having a consistent ovulation and release of egg. You are going to be more at risk of low progesterone when you have a pregnancy or a conception, because the ovary is tasked with making that progesterone in the first trimester itself. After that, the placenta takes over the progesterone production, and usually it's smooth sailing. But especially for somebody who's PCOS and is having some fertility issues, supplying you with progesterone and supporting you with progesterone through that journey is very important. And so it takes a combination of us knowing that and trying to get you the right tips and tools. And then also knowing things like progesterone creams actually aren't penetrative enough to provide protective levels to the endometrium. You're going to need a pill or a ready dissolvable tablet or a troche. So you really do need to work with providers who know their stuff in that world, because we want the best results for you.
Mm-hmm.
Yeah, absolutely. Do you have anything to add to that?
I was just going to say what my role would be is to support these guys once they get the blood tests and what kind of things that they need to support the person to help them with their PCOS. Is I can create cocktails through the IV world to supplement that. So if vitamin D is low, we can start with injections. But other things like immune issues, if there's tons of inflammatory issues. So it's kind of nice because we'll all work together and make it individualized. So it's not just a cookie cutter approach.
Yeah.
It's personal.
Yeah, so that's very, very important, because one of the things you said, Dr. Ellie, and I'm going to piggyback off what you both just said, is when you recognize cortisol was an issue. And so different things can cause elevation of cortisol, like a sleep disorder can cause it. Stress response can cause it. There's a multifactorial approach. Something from our environment can cause it. So cortisol spiking ends up causing an insulin resistance type scenario, like Richelle was saying. And in functional medicine, we learned early on that PCOS was insulin resistance of the ovaries. Well, it's a lot more than that. And so there's many things that can actually play into that. And we look at other stuff too, because one of my favorite doctors who deals with breast cancer health, ovarian health, he is the iodine king when it comes to just iodine and its uses. And here at Synapse, we do thermography for the breast health, but it's hard to visualize the ovaries on thermography, so you can't get it. And ultrasounds don't always pick up on cysts. And let me just ask you straight up, Richelle and Ellie, do you have to be overweight and have cysts to have PCOS?
Oh no, actually you can be very thin.
Do you people see how
That's a
fast
big misnomer.
that is bang on, and I want women to hear this, because there are women out there, if you're doing everything right, eating, exercising, you're pouring into yourself and nothing is budging, it's very, very likely that PCOS is part of that process, even if you don't fit the so-called textbook version of it. And so working with the team, the amount of tools we have to actually bring that to fruition and to just give you peace of mind that that's actually what you're dealing with, I think is so important for the psyche, because sometimes I've had a lot of women struggling, and they break down because they're at the end of their rope, because they feel like they've tried everything. And what do, especially, I'm going to throw the male doctors under the bus here, what do we do when a woman comes and we've tested everything we think is called everything, and we can't find anything? What category do we put them in? Mental illness. That's historically, I have on my shelf a book from the 1930s. It's a surgical book, and I keep it there on purpose because speaking to PMS, it used to be a psychiatric disorder. In the 1930s, it was a psychiatric disorder. And so I keep that as a reminder of what we don't know as doctors when it comes to how the human body actually works, and how wrong historically we've been in a lot of things, because it is 100% not. And we now know we've got a lot of tools in the toolbox. So I appreciate just, again, the aspect that all of you bring to it. And I'm also going to say this, we have a secret weapon on our team, and her name is also Ellie, who deals with emotional trauma and some of the impact that not getting help, not feeling heard, having hormones out of balance, there's an emotional consequence to that. And that's her specialty. She couldn't join us today, but she is brilliant at what she does as well. So I just want to put a little plug in there for her, because she has helped a lot of us. So with that being said, I do want to touch base a little bit on the mental wellness side of things. One of the protocols that I absolutely endorse and love is the Walsh protocol, and it has to deal more with biochemical scenarios, methylation, and different disorders of histamine and one issue where it's called pyrrole disorder. But when we have a chronic stress response, we tend to become depleted in zinc, which can cause a copper zinc imbalance. And there's so many components of how that plays into creating insulin resistance, how that plays into lower stomach acid, and then you don't absorb the proteins as much. And a dual zinc and B6 deficiency causes a significant change in your neurotransmitters in the brain, and something called an elevation of pyrroles, which are actually neuroinflammatory, neurotoxic. So sometimes it's as simple as restoring your B6 and zinc and copper balances in conjunction with a lot of this. When you get the hormones balanced, you get your digestion balanced, and you get some of these weird nutritional imbalances corrected. The thing I love hearing from my patients, male or female on this one, is I feel like I've got my brain back. I feel like I'm back. Who I am, I'm back. And I'm sure you've both heard that as well when it comes to working with women's health, when you get things restored.
Yeah, I'll say on my end, one of the first side effects women usually, I'll air quote, complain about is I have deep rest again, and I feel myself again. That's more traditionally on the postmenopausal female end, when I'm talking about specifically, but when we give you that progesterone, when we give you progesterone in a pill form, it uses the GI tract to metabolize itself. And so when it cleaves in the liver, one of the metabolites of that progesterone will go up and sit on the GABA receptor in your brain and produce a sense of calm. And it will give you that sense of peace and well-mindedness and sleep. And sleep, if we're talking about detox, is so important for your detox pathways. So that's one of the favorite things I get to potentially gift to women in some sense, is that when we get your progesterone in back rocking and grooving, that can be actually a very powerful mitigator against anxiety, chronic stress, worry, depression. Progesterone is a very magical little item for that, I'll say in that way. Testosterone too, though. Testosterone can be a mood balancer. On the negative end of it, if we overshoot you, which we don't do that here at Synapse, you can get a little irritable or a little impatient, we'll just say that. Or you might chase your husband around the bedroom for a little while. When we can get it back to a very happy spot for you, that can actually really improve just your outlook on life alone. So hormones do contribute to our mental health, just as the copper, just as the zinc, just as the B6 do. And that's why it's so important to check the foundations of who you are and how that changes over seasons, because we do experience changes just as we, age and go through life, but also based on our environment and what we're interacting with. And that obviously is always up for grabs in some areas. So yeah, just corroborating what you're saying, Dr. Troy.
So one of the foundational principles of functional medicine is restoring communication. Functional medicine, the premise is a breakdown in communication leads to dysfunction. Dysfunction leads to disease. So it's all about proper communication.
Yeah.
And so a lot of the things in our toolbox are communicators. Hormones is a different language. It's a communication language. Also, I want you to speak to peptides and then exosomes. I'm going to have Tammy speak to exosomes. And there's actually one other thing that you have used during the COVID scenario, oxytocin.
Yes.
I want you to talk a little bit about that too. Let's start with oxytocin and move into
these are like my secret weapons. I love them. They're so good because they work for everybody and they're so helpful. So oxytocin, we can talk about it in the post-COVID world. It really helps restore taste and smell, and it can work in tinnitus as well. That's male and female, by the way, if you have male listeners on here. Female-wise, though, specifically, and for some males too, I have found it to be a powerful mitigator of migraines, especially if you're someone who has a little bit more estrogen dominance. Oxytocin can really help just calm neurological inflammation. Oxytocin is given in a nasal spray. So oxytocin is a hormone that you have in your body as a female. You produce it at a small level, on the daily. But when you are post-pregnancy and postpartum, you will produce it in a mass quantity to give you that social bonding experience with your baby and also to help you produce milk. Now, if I give you oxytocin, though, in a peptide spray form, I promise you will not lactate and produce milk, okay? Because it's far, far lower in its dosage than what you experience in a postpartum state. However, oxytocin comes in sublingual tablets and it comes in nasal spray form. And nasal spray form has been used in research for years with PTSD, anxiety, trauma, and sexual health. In sublingual form, it's more specific for sexual experience. It can help promote a little bit of vasodilation and some nitric oxide production, so you recruit blood flow to the organs where they need the attention during the sexual experience. It can also help you with being calm during that experience, and it will promote intimacy between you and your partner. So oxytocin is very useful, very relevant in that. But then on the other flip side, it has these other creative benefits that you can do in a nasal spray form. So I believe that's what Dr. Troy is alluding to. It's been our secret weapon, especially for migraines, ladies. If you have migraines, try oxytocin. It won't break the bank, and it'll get you off of some drugs even. Can't promise that, but I can say like really good percentage it works.
We've seen a lot of good results, a lot of happy campers as far as their symptoms improving. So.
And chronic pain. I forgot to say that. Chronic pain and oxytocin, which we use that here in our Lyme's patients for Synapse, and I've seen some decent benefits with that too, as adjunctive therapy. So oxytocin is a real fun one to be able to use in this space of functional medicine. But the other other peptides that have been available to us to use is something called PT141. Sounds very militant, but it works. And it helps promote the neurological side of sexual stimulation. So we have the hormone side and the lovey-dovey side with oxytocin, but then we have the neurological component, and that's what PT141 really focuses on. That's also a sublingual formulation. And sometimes we compound them in together. We do oxytocin and PT141 with a little bit of sildenafil, so we just complement the whole experience. But we can use those things just to improve sexual health, beyond doing things like testosterone applications, if you qualify for that based off of your blood work.
Yeah, do you want to speak to exosomes?
Yeah, absolutely. So exosomes are a microvesicle that comes off of mesenchymal stem cells. And we get ours from donated umbilical cords that the mothers, okay, so just to backtrack, mothers donate their placenta umbilical cords because if anyone doesn't know this, that actually gets thrown in the garbage after delivery. And so it is all women that have consented to this. And so there's no ethical issues there. But then we use a FDA approved lab that screens these cells. And so the exosomes are these microvesicles that contain messenger RNAs, they have growth factors, and they really do cell-to-cell communication. And so one of the great things about using these is that as we age, we lose these factors in our body and we start to degrade, I guess. And when you use exosomes, it really does promote regrowth of nerves and tissues. And so it's great for like sexual health. And because they're so tiny, they can actually get through the blood-brain barrier. So it helps with like the migraines that we were talking about, or depression, especially for people that are post-COVID or post-Lyme that they've had for a long time, or chronic Lyme, I should say. So they're a very good tool in our toolbox to help with things. If we've tried all this other stuff, let's try this too.
Yeah, and just to reiterate, these are pure samples. They've been vetted very, very well. And a lot of these natural innate peptides and proteins and things that we have within us, they're actually influenced by inflammation. So a lot of times they're like these small little particles that get burnt up in the body's inflammatory reaction. So that's why chronic inflammation can lead to a breakdown in communication dysfunction. And so while we work on the foundational things that set up the inflammation, we also can restore a lot of that communication system and allow your God-given communication processes to take over again, and you start to see the lights come back on. So there are other things we use nutritionally as well that I have just used in the past that we're seeing we need a little bit more. And this speaks to a little bit of what we heard down in Atlanta, where again, we're having to do layering of therapies to get the same results that we used to get 20 years ago. We're having to do more things with people to actually get the results. And that's a sign of just the inflamed state that we're in. And there's a lot of foundational stuff like our food supply and all those things that are being cleaned up, which is fantastic. But we focus on that here, and we have specialists like you three that are helping navigate that and choosing the best path for success, and communicating with each other. And I think that's one of the biggest things, is actually having a team that is willing to communicate. And we have a saying here, excellence without ego. And there's a lot of brilliant people that I'm surrounding myself with that are extremely humble. And so you three are all in that category. And so I am excited to see what happens for 2025 and beyond when it comes to just implementing these new protocols we're releasing to the people. And I want to thank you all for your time, your input, your expertise, your dedication to your excellence, because I know all of you, every single one of you, are doing work outside of your normal office hours of seeing people to just improve your craft and be elite at what you're doing. So I really don't think people understand how much extra effort some of these elite doctors that we're bringing in, how much extra they put into it. So I appreciate all of your hard work and even more just who you are as people and how you present yourself to the patients.
Well, thank you. And thank you for allowing us a space to do it and to really be the ringleader of it all, so that we can think tank together, because there are solutions waiting to be birthed out there. I really firmly believe that. And sometimes they're happy accidents, and sometimes they're very purposeful based on, the research we have at hand and what we think we can do about it. So I enjoy being a part of this team, and I look forward to many, many good success stories of people being well.
Mm-hmm.
Excellent. So with that, we will see you all next time. Thanks again for joining us.
Thank you for listening to the Synapse Snps podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Snps podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.